Good afternoon. Welcome to our Facebook Live event. August is National Immunization Awareness Month, and we're here today to particularly talk about adult immunizations. I'm Laura Spradley. I'm the Outreach Coordinator here at the Institute on Aging, Department of Geriatrics at UAMS. And with me is Dr. Robert Hopkins. He is Professor and Director of General Internal Medicine here at UAMS. And this is a topic that's near and dear to his heart. He's a sought-out speaker on this topic, and he's so well versed on it that he was recently appointed chair of the U.S. Department of Health and Human Services National Vaccine Advisory Committee. So we have the expert right here with us, and we so appreciate him taking his time to be with us today.
Happy to be here, Laura.
Thank you. We have a few little housekeeping details we want to go over. Be sure and send us your questions via Facebook, and we'll answer them. And we also want to be sure that everyone understands that this is an educational event. It's not designed to take the place of you having a one-on-one conversation with your physician about your vaccination needs. So without further ado, we're going to get started, because I want to hear all about adult vaccinations. I have a very basic question, Dr. Hopkins, if you could help me understand, what is a vaccine?
Well, a vaccine is a product that is given to an individual, usually by injection, but some are given orally, to help stimulate that person's immune system and help prevent an infection or another insult. When I think about vaccines, I'm primarily focused on preventing infectious diseases. We now actually have vaccines that can be used therapeutically or to treat certain diseases or to help prevent some other things that are not infections. Our focus today is going to be on preventing infectious disease, but important for people to know that vaccines are not only an infectious disease issue in 2018.
Okay, well, thank you. And then I got vaccinated as a child and then through school and in college, so why do I need to get vaccines as an adult?
Well, we are still exposed on an everyday basis to infectious diseases. If you think about our common issues, influenza can affect people of all ages. Influenza causes hundreds of thousands of hospitalizations every year here in the United States and over 10,000 deaths a year. Most of those are in adults, and so adults need vaccination to protect them against influenza. There are other infections like pneumococcal disease that we have tens of thousands of hospitalizations due to. There are over 1 million cases of shingles a year. All of these are vaccine preventable diseases that are important for us to protect adults from.
Wow, I didn't realize that about shingles. Well, something near and dear to our hearts is, aren't most adults in Arkansas, though, immunized?
Unfortunately not. We don't have great way of assessing that data other than by surveys. But the survey data shows that less than 50% of Arkansas adults are protected against most infectious diseases that we can vaccinate against. The best protected groups are adults 65 and older. For influenza, roughly 2/3 of that population last year was vaccinated, and roughly 2/3 of adults 65 and older received a pneumococcal vaccine. Still far less than we need to protect all of the people in that age group, and rates in other age groups and for other diseases are much lower.
Okay. Well then, I mean, just asking this question, what in your experience would be some of the barriers for Arkansans that they're not getting immunized?
Well, I think there are a number of things. The first one is the point that you made in your earlier question, lack of knowledge. Many adults don't realize that they need vaccine protection for given infectious diseases. So filling that knowledge gap, hopefully with settings like this, will help. There's sometimes an issue of trust of vaccine recommendations or the vaccines themselves. There's sometimes a lack of knowledge that not only do those vaccines protect you as an individual, but they also help reduce the likelihood that you're going to transmit it to members of your family, to others within your community, or potentially even worse, to your children or grandchildren or others around you. So vaccines have protective value across multiple different levels.
Thank you. And then one last question, because we're getting some questions online, but don't forget to send your questions to us, and we'll get to you right after this question that I have. Let's go ahead and tell them about the types of adult vaccines that you recommend for adults.
Well, I talk about vaccines and vaccine science regularly. Often it's an hour or hour and a half session for physicians. So to give you the short and dirty version, first and foremost is influenza. We recommend all adults and children 6 months of age and older be vaccinated against influenza every year. Influenza is the #1 vaccine preventable disease in America. Second, we recommend Shingles Vaccine for adults 50 and older. We recommend pneumococcal vaccination for all adults 65 and older and younger adults who've got particular health care problems. We recommend the tetanus, diphtheria, acellular pertussis vaccine at least once for all adults. We recommend HPV vaccination, the human papillomavirus vaccination for all young adults up to age 26. We recommend hepatitis A and B vaccines for people in particular risk groups. So there are a number of adult vaccines for which there are recommendations that, again, a discussion between you and your healthcare provider is important to figure where you fit in that risk group.
Okay, I think we're going to get into more detail. Oh, we have a question from Tim. He's asking, when do adults need to get the pneumonia vaccination?
Okay. Well, there are two easy parts to that to answer that question. On the one end, all adults 65 and older need both of two different pneumococcal vaccines. One we call PCV, or the pneumococcal conjugate vaccine, the other called pneumococcal polysaccharide vaccine. Under age 65, if you have chronic heart disease, lung disease, liver disease, or any type of disease or on medication to impair your immune system or suppress your immune system, you need to get pneumococcal vaccinations at a younger age. So lots of people need pneumococcal vaccination, and they're very complex. So again, good conversation with your doctor.
With your own doctor. Okay. Well, very good. Don't forget to send us your questions. And I have another question for you, though, while we're waiting. What are, if there are any, potential risks from some of those vaccines that you just mentioned?
Okay. Well, as we mentioned earlier, vaccines are designed to stimulate your own immune system, your own protection system, to help keep you from developing infections. When you stimulate the immune system, you can often get sore arm, you can get fever, you can sometimes get chills, you can sometimes even develop a little bit of a rash. So symptoms of stimulation of the immune system I would expect with many vaccines.
Okay.
Now, those all tend to be very mild. Severe vaccine reactions are exceedingly uncommon. They can happen. You know, we can't predict 100% who's going to be allergic to a vaccine product, but they're so uncommon, they're on the order of less common than you being likely to be struck by lightning or in a plane crash. So it's very, very unlikely for you to have a severe vaccine reaction.
Well, thank you for clarifying that. Oh, boy. My mom asked me this one. She said, I'm over 65, and she's heard that there's a special flu shot for anyone over 65. Is that true?
It is.
Really?
It is. There are a number of different flu vaccines that are available in this country this year, some of them tailored to particular age groups, others like the egg-free flu vaccine that's available for those who may have severe allergy to eggs, so we can protect those folks against influenza. But there are actually two vaccines that are specifically tailored to improve the immune response to flu vaccine for older adults. One that we call the high-dose flu vaccine that has a higher dose of the 3 different types of flu that we are protecting against this year. The other is what we call an adjuvanted flu vaccine. That means it's got an additional medication in there to stimulate the immune system in people who may not respond as well. Either one of those vaccines is designed to help older people's immune system respond better and protect them better against influenza.
Okay. So once again, talk to your physician.
Talk to your physician, that's right.
All right.
That's right.
Oh, we have another question. Valerie's asking, who is the Hep A vaccine recommended for?
Okay. Hep A, or hepatitis A, is a virus that can be passed from person to person, primarily through contamination. Fecal oral is the term that we use. Hepatitis A vaccine is recommended for people who have chronic liver disease. It's recommended for men who have sex with men. It's recommended for those who may be exposed to contaminated food or water. And if you're traveling to many third world countries, you might need hepatitis A vaccine. There's, again, a list of reasons that you might need it. Worthwhile talking to your doctor, or you could go to the Centers for Disease Control website and look for vaccine recommendations for adults, and it'll give you that information.
Okay. And we have another question. Keith is asking, how do you know if your daughter should get the HPV vaccine?
Well, Keith, I would tell you, I have a daughter now that is younger than the age recommendation. I have two sons that are in their late teens, both of whom have had HPV vaccine. I would recommend HPV vaccine for anyone who is from 11 to 21 years of age. If the vaccine series started before age 14, you only need 2 doses of the vaccine. If it started after that, you need 3 doses. But this protects young people against human papillomavirus, which is one of the most common viral causes of cancer that we have. So cancer prevention is very important for all of us.
Great. Thank you, Keith, for that question. And Karen is asking, Dr. Hopkins, are there any special indications for asplenic patients?
Yes, people that have had to have their spleen removed or who have conditions that causes the spleen not to function, like people who might have sickle cell disease, need protection against a number of things. We've talked about influenza. Influenza is for everybody. Pneumococcal infections, it's very important that we protect against pneumococcal infections. Meningococcal infections, that's another bacterial infection that's common in folks that have a spleen that doesn't work. And Haemophilus influenza type B infections. So there are a number of vaccines that are recommended for people whose spleen doesn't work or isn't there.
Okay. And once again,
see your doctor. That's right. That's right.
Very good. While we're waiting for some more questions from the audience, I have one. I think did we talk about this one about whooping cough?
We haven't.
We haven't. Okay. Thanks for the jog on the memory there. I have a friend who has a new grandbaby, and she said that she had heard that there's some pertussis or whooping cough vaccine that she could get, and it would be for her to prevent giving it to the grandbaby?
That's right.
Okay.
So whooping cough is a bacterial infection that is probably more common in adolescents and adults than it is in children, but small babies are the ones that carry the biggest burden of disease. They're the ones most likely to be hospitalized or, unfortunately, even die from pertussis. Mm-hmm. There is a pertussis vaccine called Tdap that is recommended for all adults at least once in their adult life. And in addition to that, any woman who is pregnant should get this Tdap vaccine in their 3rd trimester of pregnancy to minimize the likelihood of their transmission of this pertussis to their baby. So pertussis protection is very important for babies. I would encourage anybody that's going to have a new baby in the house or in the family, make sure everybody's up to date on that pertussis protection.
Wow, great. Okay, and we have a question from Nita. She's asking, what age do you recommend a woman to get the shingles vaccination?
Okay. Well, there are 2 shingles vaccines to talk about. One is an older shingles vaccine that we're not using quite as much anymore. It was a live shingles vaccine. The current vaccine we use is called a subunit vaccine. It's called Shingrix. It's got a subunit of the shingles in it along with an adjuvant to make it work better. The Shingrix vaccine is recommended in all adults starting at age 50. It's a 2-dose series. You get 1 dose and then a 2nd dose of the vaccine. And it is over 90% effective in prevention of shingles in folks from 50s on up through their 80s. The trials were done across those groups. The only challenge we have right now is there's a bit of a shortage of shingles vaccine in the United States right now, including here in Arkansas.
Oh, wow. Okay. Well, that kind of is along a question that I had for you. If someone has already gotten the prior shingles vaccination, can they turn around and get this new
Yes.
vaccination?
If you've had the prior live shingles vaccine, which was known as Zostavax, you can get the new shingles vaccine. Probably should wait at least 2 to 3 months after that prior live vaccine before you get the newer vaccine. The same thing would apply if somebody has had an episode of shingles. They still can get this new shingles vaccine. They're not protected for life because of that episode of shingles they had. But I would probably wait at least a couple of months after that episode before they get vaccinated.
And then with this new shingles vaccine, there are 2 doses.
It's 2 doses, that's correct.
You get one and then you wait.
You get 1 dose, then you wait 2 to 6 months to get the second dose.
Okay, very good. Oh, we have a question. Leanne is asking, how often should adults have Tdap vaccines?
So other than the situation of pregnancy, in which we recommend a Tdap vaccine every pregnancy in the 3rd trimester, 1 dose of Tdap is recommended for all adults. And then short of that, we recommend giving the old-fashioned tetanus vaccine as a booster every 10 years to maintain your tetanus protection.
Okay, very good. All right, so I think you just answered one of my last questions, is that everyone should get a tetanus booster.
That's right.
Every 10 years.
Every 10 years.
All right. And this one, just in case I was lucky enough to get to travel overseas someday, where should I go to find out what vaccines I might need to get?
So vaccination for international travel can be pretty complex. There are recommendations that are based on where you're going. There are recommendations that are based on what you're planning on doing when you travel. The best source of that information is through the Centers for Disease Control. Their CDC travel immunization site can give you very comprehensive recommendations. There are 2 parts of that. One is focused on the provider community, people like me, to help you know what you need to do, and the other is focused on individual patients making a decision what they need to do to be best protected on their own.
Okay, very good. And then one question I have is, I think that I have or if someone has misplaced their vaccine record, how do I get them to a place to get that reproduced?
That's a real challenge with where we are right now. There is not a national vaccination record in the United States. There is a record in Arkansas called WebIZ, which is the statewide immunization registry. That contains all vaccination records of children that are vaccinated, and we're getting more and more adult data put into that system. Because we don't have a systematic way of controlling that information now, I suggest that we do 3 things to try to keep up with our vaccine information. One is I encourage people to have your own personal vaccination record. Whether it's on the old yellow card that many of us had as children, whether it is scanned into your phone or on your computer, keep your own record. Number 2, make sure that if you have vaccines that you know you've received and you've got that record, get a copy of that record to your physician or provider so that they can have that in their record system. And then 3rd, if you get any vaccines given to you, whether by a pharmacy, the health department, or a provider, ask that person that gives you the vaccine, please make sure this gets into the state WebIZ system so that we have that information there and we know later what you need or what you've already had.
Good information. I did not know that. All right, we have another question. Karen is asking, can sexually active adults benefit from HPV vax? Insurance will not pay for it.
The HPV vaccine that we have available now is a very good vaccine. One of the limitations to that vaccine, though, is if you've been exposed to HPV previously, the vaccine doesn't protect you against types of HPV you've already been exposed to. And so currently, the recommendation is that we give it in people up to age 26. It's not recommended beyond that age because you may very well have been exposed to those types and not get any benefit from the vaccine. So there may be some potential benefits in a given individual, but again, that's worth a one-on-one conversation with your healthcare provider.
Good advice. Okay, we have another question. Laura is asking, what are the recommendations for immunocompromised patients?
Okay. Well, immune-compromised patients, meaning people whose immune system doesn't work well either because of a disease or because of treatment, need more immunization generally than those who have a normal immune system. Flu vaccine is the same. Immune-compromised or normal immune system, you need a flu vaccine every year. Tetanus and pertussis vaccination, same whether you have immune compromise or not. Pneumococcal vaccination needs to be a combination of the PCV or the conjugate vaccine and the polysaccharide vaccine, even in young adults with immune compromise. And then you may need booster dose of the polysaccharide vaccine, and then you'll need an additional booster after age 65. And then depending on what particular condition you have that led to the immune compromise, you may need additional vaccines too. If you're immune compromised and over age 50, for example, you still can get the new shingles vaccine. When we just had the live shingles vaccine, we didn't have that as an option because you don't want to give a live vaccine to somebody whose immune system doesn't work.
Very good. And Valerie is asking, what's the best time of the year to get your flu shot?
Well, flu vaccine is available now,
Oh, is it?
and so it is reasonable to go ahead and start getting flu vaccine as early as today.
All right. Plug.
The goal is to get your flu vaccine done well before we start to see true influenza in your community. It takes about 2 weeks for you to develop a response to the vaccine, and so we want you to be vaccinated well ahead of when you're seeing flu in the community. Now, generally, if you've got a robust immune system or you get the appropriate vaccine, say in an older person you get the high dose or the adjuvanted vaccine, if you get that vaccine now, you're likely to have antibody protection for that influenza for 6 or 8 or even 8 months or even a year. And so there's no reason not to get the vaccine now or to wait for later in the season.
Okay. Flu season
Typically in Arkansas, we start to see flu around the first of the year, but we've had years that we've seen it as early as June. So, that's not usual, but we want you protected as soon as we can get you protected.
Very good. Okay, we have another. Jyoti is asking, are there any effects of the shingles? Does insurance pay the expenses? I guess she means side effects from getting the shingles, maybe?
Well, if you have the shingles vaccine generally is a safe and effective vaccine like the others. Because the new shingles vaccine has an adjuvant in it, an additional stimulator for your immune system, it is more likely to cause a sore arm, fever, maybe even some chills after you get the new shingles vaccine. But that doesn't mean it happens in every person. And if you get it with one dose, doesn't mean it'll happen with the other dose. But it is highly effective at protecting people from shingles. Unfortunately, shingles vaccine is one that payment can be a bit of a challenge. Generally, the shingles vaccine, if you have one of the private health insurance plans that meets the requirements for the Affordable Care Act, that plan should pay for shingles vaccine for anybody 50 years age and older. Unfortunately, if you have Medicare, Medicare considers shingles vaccine under its Part D drug plan and not under its medical plan benefits. And so if you have Medicare, you are likely to get your best deal or lowest cost getting the vaccine through your pharmacy rather than your doctor's office. Talk with your pharmacist about what the cost and potential copay may be.
But then once again, make sure your doctor gets that information.
But make sure your doctor gets that information also, absolutely.
Very good.
Yeah.
We have another question. Is there printed information or schedules on all vaccines somewhere?
Yes, there is. If you go to the Centers for Disease Control website and type in adult vaccines, you can get all the adult vaccine schedules. If you put in adolescent or childhood vaccines, you can get the adolescent and childhood schedules. Other professional organizations may also have schedules, but that's kind of the central clearinghouse of adult and childhood vaccine information.
Okay. I have another one. What if I'm allergic to antibiotics, or if someone out in the audience is allergic to antibiotics? Does that affect vaccinations?
Well, it does, but it doesn't. What I mean by that is being allergic to antibiotics does not increase your risk of having vaccine adverse events. But if you have somebody that has allergies to antibiotics or limitations to what they can potentially take, then I would want to make sure that person is immunized as much as possible to reduce the likelihood of them getting an infection they might have to take antibiotics for. So not necessarily an association of risk, but more one of making sure that we protect that person as much as possible.
Once again, check with your doctor.
Check with your doctor, that's right.
All right. Well, unfortunately, we're getting the sign that we have to wrap up. I know, we were just getting started.
That's right.
We're on a roll here. It's been great. We thoroughly have enjoyed having you here. I appreciate all of you logging on to Facebook, sending us your questions. They were wonderful. Dr. Hopkins, do you have anything that you can think of that we've forgotten or that you'd like to say to the audience?
Well, I think when I talk about vaccines, I generally talk about 3 primary points. One is vaccines are safe and effective ways to prevent infectious disease to you, to your family members and to those in your community. So I encourage people to get vaccinated. Second is, don't forget the value of simple interventions like washing your hands, and if you got a cough or sneeze, cough into your sleeve rather than into your hand. And then finally, if you have questions or concerns about specific vaccines or specific ways to protect yourself, please talk to your doctor or healthcare provider. They can give you the best individualized advice for your health.
Well, once again, thank you. Great summary there. I want to be sure and remind everyone that if we did not get to your question on Facebook, we will get to you after the show and get an answer to you as soon as possible. I do want to give credit to the program being sponsored by the Arkansas Geriatric Education Collaborative, which is commonly known as AGEC, AGEC, of the Donald W. Reynolds Institute on Aging and the UAMS Centers on Aging. The AGEC is funded through a Health and Resources Services Administration grant, and you can always go to our website, which is agec.uams.edu. And on that website, you can find all of our upcoming events, programs, anything from vaccination events to family caregiver events. So please always check our website to stay up to date on what we're doing here at UAMS. We appreciate you, and we hope you have a great rest of your day.